Hello, thank you for joining us and welcome to Sunday Interview. I'm your host, Grevazio Zulu. Now, there seems to be general consensus that the country's health sector has not lived up to the expectations of many people. Healthcare provision has over the years suffered inadequate resources, poor and insufficient infrastructure, brain drain and demotivated human resource, as well as frequent shortages of drugs. Government, on the other hand, is making huge promises that ideally should result in quality of health service as well as frequent shortages of drugs. Government, on the other hand, is making huge promises that ideally should result in quality of health services, infrastructure development, disease control, and curbing of maternal and child deaths. How will this be done, and how soon will it happen? Sunday Interview this evening features newly appointed Health Minister, Dr. Chitalu Chilufya. Doctor, welcome to the interview.
Thank you very much, Grevazio. Good evening, viewers.
I must start by congratulating you for being appointed to this very, very important ministry.
Thank you so much.
Now, I've spoken to a few people I know that I've met, and they've spoken highly about you from the time you were graduated and posted to Southern Province, that you've done a wonderful job. You're a man of action. Is this what the Ministry of Health has been waiting for? Are you the Messiah?
Well, thank you for your kind words. But Grevazio, I must be quick to state that I am grateful to the President, Mr. Edgar Chagolungu, for entrusting me with this position, and also grateful to the people of Mansa who gave me the mandate to represent them. I must be quick to say also that I was privileged to serve as an apprentice under a luminary, a patriotic son of the soil, Honorable Dr. Joseph Kasonde, and few are blessed as I have been to have learnt a lot from him, and he set a firm foundation, and we're building upon that foundation. And I must emphasize that it's teamwork. Wherever we've posted success gains, it's teamwork that has worked. So no one individual succeeds alone, but success is a function of a well-coordinated team, a well-built and well-coordinated team. But thank you so much for the kind words.
Well, you're well versed with the Ministry of Health. This is where you've lived almost all your adult life, grown up there, worked there. You understand the health system in and out. What would you say is the most single major problem that the health sector faces in Zambia today?
Well, thank you very much, Grevazio. Well, the one thing that we should all be talking about in the health sector today is service delivery to the citizens of this country. Now, the Patriotic Front government under His Excellency Mr. Edgar Chagolungu has set a broad goal to transform this country into a middle-income, prosperous country by the year 2030. In Friday's address to Parliament, the President spelled out a clear and concrete agenda on how this would be achieved in the next 5 years. I must state that it was a very healthy policy statement. I say so because, one, the President addressed key things that have to do with the health of the citizens. This government regards health as an investment. The President talked about double-digit GDP. For you to enhance productivity in the country, you need to address one of the key determinants of productivity, that is labor. Now, us in the health sector, we are concerned about creating a healthy labor force. And therefore, working with other stakeholders, our primary goal shall be to ensure that citizens are healthy. The question is, how do we do this? We have adopted a health system strengthening approach. We want to look broadly at health systems. We want to use the primary health care approach. We want to emphasize that in this order, we will provide services to the people of this country. We will provide health promotion. We will provide services that will prevent diseases, control diseases, and we will cure and rehabilitate. That is service delivery unzipped. Now, one big problem that the health sector faces in terms of enhancing service delivery is human resource. Human resource has posed a challenge to the provision of adequate health services. This government has not been idle about it. And as we speak, we have a robust human resource development plan that is looking not only at training of human resource, but is also looking at recruitment. The government has just approved recruitment of 9,000 health workers between 2016 and 2017, and we have already recruited the first 1,900 this year.
Do we have that number? Do we have 9,000 health workers sitting idle at home, walking the streets?
We have combined, that is looking at nurses and other paramedics, we do have that number. And what we just need to do is to match that pronouncement with Treasury Authority. So Ministry of Finance has been supportive, and so far they've released 73 million kwacha, out of which we've employed 1,900 health workers. We are discussing with our colleagues at Finance to get some more resources to mop the other health workers that are on the street.
Now, when you talk about recruiting and having more human resource, and human resource being a major problem, I remember that government worked out a national training operational plan for 2013 to 2016. Did we achieve what we wanted?
Yes, we posted significant gains. We built new training institutions. We expanded old training infrastructure, and we managed to increase the intakes in most of our institutions. We embarked on construction of a new training institute that will be taking 3,000 students, and it will be complete in October 2017.
So we're already behind schedule. Your national plan, operational plan, was for 2013 to 2016.
Well, so far, there are some training institutions that are already complete. Tsenanga School of Nursing, for instance. Kaoma has also started recruiting. And the old schools have expanded significantly. The Copperbelt University is ready, and it's going to take new students. And the Copperbelt University is now, medical school, is now enrolling more than before. So all these facilities that have been rehabilitated are now taking more students. So we are not behind schedule, and we have seen in the last 3 years that the numbers that we're graduating have actually increased. In the past, you'd get 30 doctors graduating from the School of Medicine, but now we're talking of more than 100 doctors graduating, and put together with the private schools, with the Copperbelt University now, we'll be talking of in excess of 200 doctors graduating at a go. So our long-term projection looks very bright. And
doesn't match with quality. Are we talking quantity?
Well,
of course, there's the issue of private institutions coming in, and usually when the private sector takes a center stage, the quality standards may fall. Are you taking care of this?
It's very important to note, Gravazio, that we have the Health Professionals Council of Zambia that has set minimum standards for training institutions. So all private schools are accredited before being allowed to enroll medical doctors or students for other health sciences. So we have a robust monitoring mechanism that assures quality of training. And whenever we think people are falling short, we do move in and ensure that we take remedial measures, which may include suspension of those training programs.
I know that in the past we spoke of 43% in terms of health, human resource in health. What percentages are we looking at now after your national training operational plan?
There's been an improvement. There's a lot more to be done, but there's been an improvement. For nurses, for instance, we're operating at 67%. We have an establishment of 17,000, and so far 11,000 plus, on the payroll and working in various places. Secondly, it's also important to note that on the labor market today, we have about 1,490 nurses who will absorb before the end of the year, and that will further improve the nurse patient ratio. So talking of 43%, 5 years back, we're now at 67%, so that's a major improvement, at least looking at nurses. We are also posting progress when it comes to doctor patient ratio, with the numbers that are improving. and other paramedics too. We are looking at recruiting more environmental health technologists, more laboratory technologists, more pharmacists and pharm techs, more physiotherapists, and all these are adding to the reduction in the patient health worker ratio.
For the sake of detail, how many patients does one doctor in Zambia treat?
Well, today the ratio isn't good because we're looking at one doctor for 9,400 patients. And that ratio is not good. The WHO recommended ratio is 1 to 500.
Nurses?
Nurses, we are still way behind, but we're much better than the doctors thing. Yeah, the doctors ratio is much higher than the nurses one. For nurses, we are looking at a ratio of 1 to 800.
Now, you're still talking about lack of human resource in hospitals, but there's another school of thought that we have so many doctors working as managers instead of being in the wards where they're supposed to be. These are trained doctors. They've got the skill, they've got the capacity, and we have facing almost a crisis, but we have allowed them to move on to be directors and the ministry, and they're not in the wards.
Gravazio, all I'd like to state is that when you're looking at human resource management, it's not just about numbers, it is also about how you utilize the numbers that you have. So my assurance to you and the nation is that we will be looking at our human resource establishment and making sure that all our practitioners, all our health workers are placed appropriately. And our principle really is that at the apex, we should be lean. The apex must be lean with human resource. We want our human resource at the district level, the implementation level. We want resources at the district level, human resource finances at the district level. Yes, we will put people to supervise in the provinces and even fewer people at the center to provide the policy, direction. So we will realign to ensure that we place our staff in places where they shall be optimally utilized and where the public shall benefit optimally. So we will address that concern.
So probably you're saying of having more doctors in the wards than in the offices.
We will see more doctors at district level, be it in the hospitals or in the district health management teams, but we will see health workers at the front line. And I emphasize that we will make a change only if we strengthen leadership at the front line. The district, we put resources there at the district and we strengthen human resource there. And the hospitals, we strengthen leadership in there. So I want to assure you that we will optimize the human resource that we have and we'll place people according to the skills that they have, and we will not relent on that. So we'll make sure that we realign to ensure that skill sets, competences are reviewed before we place people.
Now, when you look at this problem you're facing, some people have said this is caused by the fact that non-medical staff are running the human resource in the Ministry of Health, in the health sector. They're believers that health personnel should take up human resource courses and eventually run the health sector.
Well, Gravazio, every field is a study, then a practice. Human resource is a specialized field, so it is a study and then it is a practice. So we do respect our colleagues who are trained in human resource, and they are doing a good job in managing human resource in the health sector. Yes, we don't have a one-fit-all management tool for human resource for all sectors, and there are peculiarities that we need to be conscious of when we're dealing with human resource in various sectors, in health, in education, and so on and so forth. So we do have professionals who actually look at human resource when they're doing their postgraduate, say in public health, and they look at human resource. And we will strengthen our human resource management teams by ensuring that people who have done human resource training actually manage human resource. That is not to say everybody who is managing human resource must have a background in health. But I'm emphasizing that human resource training as a study, as a practice, can actually be tailored to the health sector. And that's what we're doing. And it is not uncommon to find a practitioner, a health practitioner, who has done a core training followed by postgraduate training with a focus on human resource. Yes, they're there. And as we realign, they may be useful in those fields, but we will not lock it up to them, because we do recognize the capacities and the support that we've received from the human resource fraternity that has been working with us in the country today.
Mm-hmm. Now, let's move on to another problem that's probably a bigger one in the Ministry of Health, that is funding. Financing has been a major challenge, and in the past, or probably even now, some hospitals go for about 4 months with no grants.
Thanks so much. Gervasio, I want to tackle that question in a broader sense. First of all, I did state that the PF government under His Excellency Mr. Edgar Chagulungu, we will focus on creating a healthy citizenry, and that our approach will be health system strengthening, and that will be using primary health care approach. And the model I'm talking about when I speak of health systems is centered on service delivery, which encompasses the whole spectrum of care, from health promotion to preventive, curative, and rehab. Now, we spoke about human resource as one major challenge, and human resource is a key variable that affects service delivery. And we are working hard to address the aspect of human resource. There are short-term measures and medium and long-term measures. Now, when it comes to the second challenge, which we've just touched, healthcare financing, that is yet another fundamental component of our health systems. We've discussed service delivery as a fulcrum, human resource as a key component, and now healthcare financing. That indeed is a very important part of our health systems model. Today, our resources are finite and inadequate. We are looking at sustainable ways, innovative ways of raising monies to finance the health sector. The President, in his address to Parliament, made it very clear that we are going to commence a scheme that shall be called a social health insurance scheme. So currently, we are looking at the legal framework that shall back the social health insurance. That will assure funding. That will also remove the need for out-of-pocket payments at the need of service delivery. And that will also be the surest way of matching towards universal health coverage.
When we talk of a social health insurance, indirectly, we're talking about a tax on the worker again.
Well, we have consensus with all the stakeholders that it would be good to contribute a certain amount of money towards this fund, and that money shall be used to address many issues in the health sector. And critically, it will also assure people that when they're ill, even if they don't have money in their pockets, they will get a service. We've done our actuarial assessments. We have looked at how to take care of the vulnerable people who are not able to pay. And we believe that with this scheme, carefully articulated and executed, we will improve the quality of health services for the people. So the cost-benefit analysis weighs in favor of establishment of a social health insurance.
Are we looking at very few people in formal employment paying this tax?
Well,
and shouldering the burden for the majority of people that cannot afford?
The details of the implementation shall be discussed in due course. For now, we're looking at the legal framework, but I must state that we will start with the public sector and move on, and we'll bring in other stakeholders. But the project implementation modalities are some things that we will tease out as we sort out the legal framework. But in a nutshell, we are going forward to establish a national social health insurance as a way of raising, as a sustainable way and innovative way of financing the health sector. And this will definitely improve access to health services and will surely put us on the march towards universal health coverage, which is what we target. So healthcare financing is something we must address for us to ensure that we address our disease.
You've spoken about this thing for some time now. When do people finally get to see it in place? 6 months, 1 year, another 2 years?
We will certainly present the Social Protection Bill in Parliament in the next legislative session. And we will definitely move towards the social health insurance program shortly. So we are certain the legal framework shall be sorted out within the next legislative session.
You're going back to the people to ask for more money, and you've been given, of course, an allocation in the budget, but we're going back to ask from the people. And people are still saying the Ministry of Health is still inefficient and not somehow at some point corrupt. What confidence do you give the people that once this money is collected in form of a social health insurance scheme, it will not be abused, it will not be misused? We'll get back to the same situation.
I'll repeatedly say this government is investing in stronger health systems. We're making greater and more effective investments in health systems. That addresses not only human resource and healthcare financing, but we're also looking at the leadership at various levels, at the district, the implementation level, at the province, and at the center there. So in terms of governance and leadership, these are matters that we are looking at very strongly. And we have posted progress over the last 5 years. And if you look at the various pillars from 2011 to 2016, we've seen a lot of progress, and even confidence from in the donors has been restored. Right now, the Ministry of Health has started getting support from a lot of donors, and this is a mark of confidence in the systems that we are putting in place. However, we will continue making greater and more effective investments in health systems to ensure even greater accountability to the public and to other stakeholders in the utilization of resources, and also ensuring that these resources trickle to the district, the front line, where people will benefit from the interventions that will make them healthy.
Let's move on, look at congestion, particularly at the University Teaching Hospital. Immediately after your appointment, this is one of your first points of call that you went to and made one important pronouncement. You gave them the hospital 7 days ultimatum to clear what you politely called floor beds.
Thank you so much, Grevasio. I want to make it very clear that this ultimatum is a statement of the sense of urgency that we are attaching to this flagship institution, the University Teaching Hospital. We do not want to accept that what we are seeing there is normal. Now, I must hasten to say that resolving the issue of congestion at UTH is not something confined to UTH itself. We must sort out our public health. We must ensure that we invest in the well-being of our people. And that's what this government is doing. We are re-engineering our health delivery model to ensure that the entry point into the health system moves from the hospital, moves from the clinic to the household or to the community. So we are embarking on community-based models that look at preventing diseases, enhancing wellness of our people, so that there is less traffic in places like UTH. So sorting out UTH involves enhancing the well-being of the health of the people around UTH. And that is the biggest intervention. That's why we speak about primary health care. The President was spot on in his address to Parliament when he spoke about intersectoral coordination. The President emphasized that in order for us to manage the well-being of our people, we need to address the key determinants of health. When the President created the new ministry, talked of creating a new ministry that is looking at water and sanitation, he actually was addressing a key determinant of health. Access to clean and safe water is a very important determinant of health, and it will keep people away from UTH and other tertiary institutions. When the President spoke about housing, the Minister of Housing and Infrastructure, he was talking about yet another important ministry, another important determinant of health: housing and infrastructure. Social cash transfer addresses household income, and good household income results in good health.
That's a long-term solution.
Now,
we're looking at the numbers of poverty being quite high in the country.
Okay.
Meaning a lot of people have no access to water, clean water, safe drinking water, which means you continue having these outbreaks of diarrhea.
It's not
cholera.
necessarily, a long-term Gravazio. What we want to emphasize is that people in the current setting must drink clean and safe water. If you're drawing water from a well, the water must be boiled and the water must be safe for consumption. If you're getting water from the river, it must be boiled, chlorinated, or treated in some way and safe for consumption. So we are going to talk a lot about how to keep away from UTH. To refocus my statement about UTH and floor beds, we are looking at low-hanging fruits, things that we can do immediately. Number one, I said the well-being of the people in Lusaka must be enhanced by escalating primary healthcare interventions that are looking at the disease burden.
Which is
we have a lot of malaria.
That cannot be achieved in 7 days. You've asked UTH to clean up in 7 days.
I'm actually coming to that.
The deadline is up today.
I'm actually coming to that, Gravazio, and I will insist that the ultimatum is a statement of the sense of urgency with which we want to address matters at the University Teaching Hospital. And there is work in progress. Yes, we will not see a surgical stop, but there is work in progress.
For 7 days is not necessarily 7 days. It's probably a figure of speech.
Well, I don't want to be reminded of 7 days being 7 days because of the 14 days.
Not being 14
days. But 7 days ultimatum meant that, one, we should do everything that we could within UTH to ensure patient flow systems, patient management systems, use of space is actually improved to reduce the possibility of having people sleeping on the floor. The bigger solution, as I said, is enhancing the well-being of our people. The other thing that I must emphasize, Gravazio, is that this government has reorganized service delivery in Lusaka. The peripheral hospitals in Lusaka, Chilenje, Matero, Chipata, we have now placed specialists, doctors in those facilities to ensure that people have confidence in those peripheral hospitals.
Are you not disappointed, Doc, Minister, that you've done all this, but people still do not have confidence in your health institutions? They still flock to UTH, meaning UTH still has the confidence, meaning the hospitals that are surrounding UTH are not delivering according to expectation. People wouldn't just want to walk from Matero to UTH. It's a cost. It's a lot of time. It's a lot of work. They don't want to move from Chilenje to go to UTH. It's because their needs are not being met.
Gravazio, it's work in progress. Right now, we are working with our district health management teams, our public relations department, to sensitize the public about the need for them to respect the referral system. We are restoring public confidence in the network of hospitals around UTH by placing qualified or a higher cadre of staff in those institutions. Now, yes, it is not a surgical process, but we will continue engaging the public and showing them that actually once they desire curative services and they get to Chipata, they can have a cesarean section. They could have other surgical services provided right there. They could find the same specialist who is otherwise at UTH, right at Chipata, Matero, and everything. We've invested in expansion of infrastructure. Matero is now a hospital. Chilenje is a hospital. Chipata is a hospital. We're looking at Chawama. We're looking at Kanyama. We've introduced surgical services in these facilities, and human resource to anchor these specialist services have been distributed to these facilities. So, Gravazio, if we look at the collaboration between this network of hospitals around UTH and the Lusaka province and the University Teaching Hospital. And we engage the public to understand the importance of the referral system. And we also invest in the wellness of our people. We will see no floor beds in any of our tertiary institutions.
Doctor, I still want to argue with you on this one and tell you probably you're probably treating a wrong problem. These people, it's not a question of understanding. It's a question of lack of confidence and their needs not being met. And they've spoken, not spoken with their mouths, but spoken with their legs and their hearts and their hands, and they've walked to UTH. They do not even have the money, but they've walked. These are the poor of the poorest in society. They've walked and gone to UTH, clearly telling you the hospitals near their homes are not meeting their needs.
To the contrary, Grevasio, our statistics are showing a reduction in referrals to UTH. From the time we opened Matero, from the time we opened Chilenje, we've seen a downward trend, and we believe that we can post more gains in that area. So our people are actually gaining confidence in the peripheral network of hospitals in Lusaka. Health services in Lusaka shall be a key focus. Lusaka, the population is huge, and that's why we are saying we will need to address health services in Lusaka in a peculiar way. Usually at a first level hospital, you will not find the specialist doctors. But because of the population in most of these high dense areas, Matero, Chilenje, we've designed a different model. While we've escalated prevention models for malaria, HIV, and TB, while we have escalated health promotion programs to prevent non-communicable diseases, we are saying for those who crash and require curative services, these facilities will be available with appropriate human resource, with appropriate equipment. And our patient flow systems and referral system will be such that we will not have these floor beds. And
what are you telling UTH, in short? People want to listen to you again. What are you telling UTH? That come tomorrow morning, if somebody is still on the floor, discharge them?
What we are telling UTH is that we need to engage strongly with the Lusaka Provincial Health Management team, where we're looking at the peripheral networks, or the peripheral network of hospitals, collaborating strongly with UTH. We're telling UTH to engage more with other stakeholders to ensure that patient flow systems, the referral system, is strengthened within the broader picture of Lusaka province. UTH has also another role of providing technical support to this network of hospitals. So UTH is working today very closely with the Provincial Health Office in addressing the referral system.
When you look at UTH, Doctor, I want to ask you, what do you see? A failed system? A scandal? A crisis?
UTH is our flagship institution, and we will work extremely hard to correct anything that is not correct. Now, I must state, Grevasio, clearly that our staff management at UTH are doing everything possible to provide good services to our people, and they're doing a great job. But there are system challenges, and we are engaging.
System failures?
We are engaging as stakeholders, but we are setting a new paradigm. So there are things that we won't accept as normal. All we are saying is that congestion in our tertiary institutions will not be accepted as normal.
Are you being polite, Dr. Minister?
Well, I'm accepting that we have challenges in the provision of health services at the flagship institution, but we are not sitting idle about it, and we are engaging all stakeholders to ensure that the system is strengthened. By the time we are done with UTH Grevasio, it will be a marvel. And I would like to be back on this program after you've picked pictures of how UTH and other tertiary institutions will be done when we're done with strengthening our health systems.
How many months?
Well,
Weeks?
There will be low-hanging fruits that you see quickly, and there will be medium-term and long-term investments in the health systems that will only mature in slightly longer periods. But what I'm going to tell you is that with greater investments in primary health care, with greater investments in human resource and equipment at the University Teaching Hospital and other hospitals, with greater investment in just systems overally, you will see improved services, not only at our flagship institution, but countrywide. And Grevasio, I must emphasize, the Minister of Health is bigger than UTH, is bigger than hospitals and clinics. Beginning with you, Grevasio, I want to state that we need to demedicalize. We need to demedicalize healthcare. Health, by definition, is talking about wellness, well-being. Our business is not just about treating you. Our business primarily is to ensure well-being of the people. That's why we're emphasizing on primary health care. When you listen to the President's policy direction, you get reminded of the Alma Ata Conference of 1978, where luminaries sat and decided what primary health care was and made a decision that primary health care was the best way to ensure a healthy citizenry. Now, if you look at the tenets that people looked at in 1978, including our own luminary, Dr. Joseph Kasonde, they looked at household income, education, nutrition, water and sanitation, immunization, safe motherhood, amongst other things. So the President's address was looking at the key determinants of health as enshrined in primary health care. So this government is on the right track because in pushing towards a prosperous nation status, we are addressing labor. We are firmly on course in producing a healthy labor force by addressing all the key determinants of health, by elevating health to a status of investment. For us, I emphasize health is an investment. Smart health is what we are going to see in the next 5 years. Smart health.
You've spoken about smart health, and that's what you want to see in the next 5 years. But there's still a major concern by the people, by the public. Everybody knows this. Low cost, high cost. For now, high cost is not a matter of choice. It's a matter of life and death. You go to the low cost, that's where the service is non-existent. You have to sleep on the floor. You're not guaranteed of life. Is this what you intended when you created low cost and high cost?
Again, Grevasio, I'll insist that what you're seeing at UTH in terms of numbers, before we even disaggregate low cost and high cost, is a failure in maintaining the people well in their homes. Now, as we plug the leak, investing in the wellness of our people, in UTH, one, will have less numbers. Two, we will treat everybody the same. Low cost and high cost does not mean that the diagnostic processes are different. Does not mean that the medications will be different. No. There may be some luxury service that may be associated with high cost, but every patient in UTH is entitled to being seen by the right health provider, being given the appropriate diagnosis and therapy, and we want to treat every client with the dignity that they deserve.
There's currently not so much dignity in the low cost. I don't know if you've seen that.
I want to repeat that there is work in progress at the University Teaching Hospital. Challenges are there. Our team is working closely with the Minister of Health and other stakeholders within Lusaka province to ensure that we address those challenges. So it's work in progress. We do admit challenges exist, but there is work in progress. By the time we are done with the health systems broadly, you will see the results at UTH. I'm emphasizing, Grevasio, that UTH, what you see there, could be the problem, could be attributed to a problem in the network of hospitals around UTH. It could be a problem in the community. So now we're taking a broader approach where we're addressing the challenges in the community, efficiency in the peripheral network of hospitals, strengthening capacities there. So UTH, as our flagship institution, yes, we will show as an indicator of how efficient the referral system is working, how efficient our services in the peripheral network of hospitals is, how well we are doing in preventing disease in the community out there. So give us time. Yes, we have challenges, but by the time we're done with fixing our health systems in Lusaka, in Zambia, we will see a very different scenario at all levels, of care. But I want to emphasize, let's demedicalize health. So we do not want to talk about health as synonymous to the situation room in UTH. That's the situation room. Things have happened. People are ill. And at any one time, 90% of the population is healthy. Only 10% may be ill. So we want to concentrate on the 90%, making sure that they are healthy so that they don't cross the wall. But simultaneously, we are making strategic investments in modernizing the tertiary level, the hospitals, to ensure that our patients are seen efficiently and are treated efficiently.
Just for purposes of reassurance, how committed are you to addressing these problems, specifically at UTH and other hospitals, so that you can restore the dignity of the people and people can feel they have a government, they have a Minister of Health?
The President emphasized improved productivity. The President emphasized multi-sectoral coordination amongst all stakeholders that shall promote the health of our people. The President emphasized that we will build a healthy labor force by addressing the key determinants of health. I want to reassure the public that this government has taken health as an investment. This government will make smart investments in health. We'll look at the information, use of information on the status of our people, use information to make informed decisions in healthcare, and make sure that our people get the full complement of health services, beginning from health promotion services, disease prevention services, and curative and rehabilitative services. This is an assurance we're giving to the people and the healthcare landscape with the smart investments that we're putting in, with a political will that was clearly spelled out by His Excellency the President, Mr. Edgar Chagolungu, who see a different health care system in this country.
People want to speak with deadlines, with timelines.
There is work in progress.
Open-ended?
No, it isn't open-ended. As I said, there are low-hanging fruits. When you hear us talking about automata, we're actually expressing sense of urgency. So there are certain things that you see. We'll not go into management details, but I know there will be twiddling of use of space, configuring how you provide your patient flow. I mean, how your patient flow systems are working. And that will show some, quick fixes, putting more people in certain places so that we have more human resource at the front line. So there will be some low-hanging fruits, some quick fixes, and people will see the quick fixes. But in the long term, the health status of all Zambians will improve. So I am promising quick fixes for some situations, but there will be other interventions which will be of medium and long term in nature, and we will see the impact much later.
One other problem, Doc, that we have, equipment and drugs, facilities. We're looking at modern diagnostic equipment like CT scanners, dialysis machines. These are a preserve of 3 provinces, or 4 to say. Commonwealth with 2 hospitals, Livingston and Lusaka. Outside that, you don't have CT scanners, you don't have dialysis machines, and people have to walk long distances to access specialized treatment.
Gravazio, again, I will repeat, in our pursuit of a healthier nation, with greater investments in preventive strategies, we are going to continue strategically investing in our hospitals. The modernization program will not cease. This government has scored progress in the modernization program. If you look at the University Teaching Hospital, Ndola Kitwe, Livingston, yes, we've seen changes in infrastructure. University Teaching Hospital today has a new adult medical emergency unit under construction, which shall be done in a few months, and that will contribute to the decongestion. If you look at Livingston, it has a new look. Kitwe and Ndola, there's a program to rehabilitate that infrastructure and expand it. This modernization program is not only restricted to infrastructure, we're also looking at equipment. If you look at the University Teaching Hospital today, for the very first time, this government has procured a cardiac catheterization laboratory. This government has constituted within the University Teaching Hospital a team that will provide cardiac services. We'll continue to strengthen this team. We have procured CT scan machines for UTH, Livingstone, Ndola. We have procured CT scans even for Kitu Central Hospital. The modernization program.
So that still remains at a very high level.
And I'll get to those.
We still have a weakness at the second level hospital?
I'll still get there. I just wanted to make it clear to you that our modernization program has been a success. And yes, we're going to continue building on it. So I'm talking about imaging equipment that has been installed in the 4 tertiary institutions. But Grevasio, I want you to know that it is not been restricted to the 4 tertiary institutions, both in terms of imaging and other diagnostics such as laboratory equipment. We have expanded this modernization program to the provincial hospitals. Remember that we target access to health services close to families, close to households. So the provincial hospitals countrywide are being modernized to ensure that clinical care services are actually made closer to where the people are. So if you look at Chipata, Chipata today has been upgraded to central status. Chipata today has been, we're installing a CT scan machine at Chipata Central Hospital. We're installing yet another CT scan machine at Mansa, General Hospital. Kasama, Kawe will be other recipients of, CT scan machines. Now, in terms of other imaging equipment, less sophisticated, all these provincial hospitals have benefited from equipment in imaging and diagnostics. That goes to show that we are looking beyond the 4 tertiary institutions. Our modernization program is slowly but firmly being extended to all the provincial hospitals. In the past, if you needed intensive care management and you were in Chipata, you would need to get into Lusaka.
You had to be flown into Lusaka.
Yes. If you were in Mansa, you needed to get into Lusaka. Today, we have intensive care services at Chipata Central Hospital, even at Livingstone. We have intensive care services in these other provincial hospitals. And we're building on to ensure that all the 10 provincial hospitals have intensive care units. We are putting oxygen plants in various provincial hospitals. So in the past, you needed to get into Lusaka. So we need to correct the impression that the modernization is just within these 4 institutions. The modernization program is being rolled out to all the 10 provincial hospitals. And we've been modernizing in a phased approach. And this shows that we are dedicated to improving clinical care in our hospitals.
I want you to speak about infrastructure. We've heard about 650 health posts. We've heard about district hospitals being built. What is planned and what is the update?
Thank you very much. The PF government has done very well in infrastructure development. We have built 40 hospitals in the last 5 years, and these hospitals are equitably distributed. We have embarked on a process to build 650 health posts. 315 are complete, and there is work in progress on the others. We have rehabilitated more than 700 other health facilities in the last 5 years. Infrastructure is a key ingredient to creating access to health services. And so we are on track. In the next 5 years, we will continue building district hospitals in deficit areas. We will complete the health posts, and we'll even construct more health centers and health posts to ensure that these primary health care services are available to the people in close to client settings. So we've done very well in infrastructure, and we'll continue, building on what we've scored.
Not and enough buildings without drugs and without human resource. Still.
Well, like I said, human resource, we are firmly on course.
Drugs.
And drugs. In the last 5 years, we saw decentralization of medical stores limited. This was meant to take the drugs closer to the people. This was meant to remove inefficiencies in distribution of drugs to the last mile, that is the clinic or the hospital. We are going to invest in stronger national supply chain systems, working with our various stakeholders. We'll continue coalition building to ensure that access to safe, efficacious drugs is enhanced for all our citizens. So you're going to see more hubs being built in the various provinces. You're going to see improved transportation systems in the various hubs. We will rethink some of the systems, and where we have insisted that the hub delivers drugs to the last mile and we don't have adequate transport, we'll engage with the various district health management teams to ensure that they participate in the distribution of drugs.
And issues of pilfering?
We have formed a multi-sectoral task force that is looking at drug pilferage. We check the last mile delivery and compare with what was ordered. We are conducting spot checks, but more importantly, we've engaged with health workers and other stakeholders to be accountable to the public, to be responsible, and to avoid pilferage of drugs. Government will be very stern in its action when it comes to pilferage of drugs.
This is a big problem that government after government have struggled to contain.
Well, I want to boast that we've scored progress again in the last 5 years, because initially when we formed the task force, yes, we saw an increase in the numbers of people that were being caught, but it was because there was a system now that was enforcing laws. But thereafter, we recorded much less occurrences of drug pilferage. So we're certainly on track. And more importantly, we are engaging all stakeholders, health workers and the community, to ensure that drug pilferage is combated.
I want you to talk about the disease burden, and we've spoken about malaria, we've spoken about TB, we've spoken about HIV and AIDS, and we've given them enough prominence and sensitization. There's one disease that is killing people, and there's very little publicity around it: hepatitis.
Well, thanks, Gravazio. As you've rightly put it, when we're talking about smart investment in the healthcare, the information on the disease burden is critical. Now, we know that in Zambia today, HIV, AIDS, TB, malaria are high mortality emergencies, and we've put in interventions, and we'll continue putting in more interventions to prevent these diseases. Hepatitis is an infectious disease, and the mortality is very high. We have started a program looking at controlling hepatitis. Our blood bank is the focal point, and apart from ensuring that all the blood screened is actually, all the blood given out to any patient is screened thoroughly for hepatitis, we are disseminating key information on how to prevent hepatitis B, how to prevent other forms of hepatitis. And so last year we did participate in the World Hepatitis Day, and we managed to give out information, key information to the public on prevention of hepatitis and how to manage it. Now, we're going to invest more in control of infectious diseases. Our surveillance systems, our early warning systems, our warning systems shall be sharpened to ensure that wherever there is a problem, we're able to pick it quickly. So apart from preventing disease and controlling it, our warning systems shall be sharpened to ensure that we pick out signs of any of these infectious diseases that may arise. So I'm actually saying our surveillance for infectious diseases shall be strengthened. But, Gravazio, it's very important to note that because of people like Gravazio Zulu now who can afford modern lifestyle, eating anything they want to eat, there is a bigger problem of non-communicable diseases. Non-communicable diseases or diseases of lifestyle are being caused by common risk factors. Physical inactivity, everyone wants to drive and never want to jog or walk. Bad diets, which are resulting in obesity. If you look at smoking, smoking is a very huge risk factor to cancers. Now, harmful consumption of substances, harmful, Gravazio, I'm not telling you to stop drinking alcohol. I'm saying if you use alcohol harmfully, it will harm your health. So all we're saying is that these are the common risk factors that are promoting non-communicable diseases. A lot of people are becoming obese, succumbing to hypertension, to diabetes mellitus, to some cancers. And we can combat these non-communicable diseases by sensitizing the public on the need to exercise. Grevasio, we've noticed some jogging clubs. The other day I called a lady who is in charge of one jogging club to encourage them. We want to encourage Zambians to protect themselves from non-communicable diseases by being physically active. Even walking within your yard is enough. 12,000 steps a day is okay. Gymming is good. Jogging is a critical investment in your health. So physical inactivity must be combated. Child obesity must be combated. Young economists, young graduates today will become obese, become hypertensive, get a stroke, succumb. That reduces productivity.
Investment is gone. Now,
Yes.
Doc, as we close the interview, if you're given 5 years to stay at the Ministry of Health, what would you want to see by 2021?
I want to see stronger health systems. I want to see specifically under service delivery, further reduction in maternal and child deaths. And this government will invest heavily in safe motherhood, in child survival programs. Immunization programs will take a part of our agenda. This government will invest heavily in protecting our mothers and our children. Minister of Health will coordinate coherently with other stakeholder ministries that are looking at key determinants such as nutrition, education, water and sanitation, housing, household income, to ensure that wellness is enhanced. This government will look at smart health, use of information to plan our health, to put resources where there shall be impact. This government will take resources to the district. The district is the implementation level. We will see more people at the district level, more resources at the district level. Escalation in disease prevention programs as a way of reducing the cost of curative services. We will see modernized hospitals so that for those of us who fall through the cracks and require curative services, we will be treated adequately in non-congested facilities. We'll introduce super specialized salary scales in our tertiary institutions to encourage our clinicians to super specialize such that they will keep the need for treatment abroad. When we talk of a cath lab and other sophisticated imaging pieces of equipment or diagnostic and therapeutic pieces of equipment, we need to invest in super specialized manpower.
Doc, that's a very long shopping list.
Well,
we hope we can manage it in the next 5 years.
That's how serious we are. But the summary is that we'll address all the fundamental components of the health systems: human resource, drugs, healthcare financing, leadership, and we will make sure that service delivery remains the focus. And you and I, the community out there, must participate in improving our health by fighting non-communicable diseases, by ensuring that we are physically active.
Then there'll be no floor beds.
Then there'll be no floor beds.
It's been a pleasure having you on the
program.
program.
Thank you very much. Thanks so much.
You've been watching Sunday Interview, and our guest this evening was the Minister of Health, Dr. Stadi Chilufya. I'll be back next week at the same time. Pleasant viewing.